So my name is Charlie Keck, and I came to Olympia in 1972, and came to Olympia in order to work for Group Health. And I've always enjoyed pediatrics, and when I was in medical school, I got a summer scholarship to work in public health, and that kind of turned me on to the idea.
Hubbard. I'm a pediatrician and have been a partner of Charlie Keck's for many years. I've known Dr. Keck since I came here in '86. When I first started working for Group Health, he was my partner and had been my partner until the time he retired.
Hi, I'm Mason. I'm a pediatrician, now mostly retired, here in the Olympia area. I've known Charlie for about, oh gosh, since we came here in 1975. Well, he's been a pediatrician both within the Group Health system, but also as a role model for the rest of the pediatricians. He's certainly shown us in a gentle way how to get along better, demonstrated that both with his colleagues, and I count myself lucky as being one of them, but also with his patients. He's been well respected in the community, both in the hospital, but also within the Group Health system.
I'm Bill Newman. I'm here in Olympia the last 30 years, and I've been a family doc working mainly at Group Health. I worked with Dr. Keck in primary care, and through till the time when he retired. He was here before I arrived, so I'm not quite sure how long he's been in the community. But I've worked with him in that capacity, also in capacity as a fellow volunteer in some of the efforts that he's made in the community since I've known him.
Charlie's been very involved in the community care clinic. When I first came to Olympia, the community care clinic was in a trailer outside on the property at St. Peter's Hospital where we're standing now. And I know he and several other partners from Group Health were very involved, instrumental in setting that clinic up, and it served for many years for a very underserved population.
When Rick Bird, who was the principal of one of the local elementary schools, called me about his concern about the Vietnamese students who were losing their Medicare, I assembled a group of citizens, professional and lay, who helped me set up a free clinic at St. Peter's Hospital.
He also has remained active in the community. He works, does some volunteer work where I do also with the Thurston County.
Most volunteer activities, there's a real sense of kind of accomplishment and something for the common good that's involved. Sometimes when you've been in your own clinic all day and you're tired, and then it's your night to work in the free clinic, you sort of drag in, and you come out feeling elated because A, you've done some good, and B, you're with a bunch of other enthusiastic people, and also you see a clientele that's not only medically interesting, but very grateful to have gotten some care.
He wasn't the kind of person who needed a lot of recognition to continue to be as involved at the level he was in our community. After you retired, you continued to see him at all kinds of events, whether it was giving a massage or taking photographs.
He told me that he was going to learn massage therapy, and I thought, well, this is perfect. Here's a man who, during the course of his professional career, certainly reached out and touched lots and lots of patients. And now, as he wants to kind of slow down and do different things, he's still doing that. He's reaching out and touching more people.
He's also got a flair for the piano. He plays jazz piano and continues to be a learner. He makes you feel good when you're around him, no matter if you're 2, 3, 17, or over 60.
Well, I find that a very humbling experience. Sure, I've been involved in some projects, but as usual, you're always thinking of other people who were as much involved or more involved than you, and so it's a real honor, clearly. Whether it's deserved, I don't know, but anyway, it's nice to have someone say you did a good job and pat you on the back.
I think the award speaks well for this community, and Charlie, being the modest guy that he is, probably feels he doesn't deserve it and feels like he may be more among the other 99% of folks who deserve recognition. And ironically, that would be one reason why he's a good candidate for this award.